Hello, everyone. My name is David Dow, Interpreter Services Manager, and I would like to introduce you to my team here.
I'm Joshua, lead Spanish interpreter.
Hi, I'm Sasha, Chinese lead interpreter.
And I'm Cecily, Spanish interpreter.
Thank you. During our response to COVID-19, many bilingual staff are placed in a situation where they are asked to use their bilingual skill often and to function as interpreters. Thank you for this service. It is an important weapon in the fight against COVID-19. The purpose of this brief orientation is to familiarize you with the basics of interpreting, specifically the roles of interpreters and some important standard of practice. The presentation will take approximately 20 minutes, so let's get started.
Okay, let's get started. First, I want to mention that a lot of the time when we're using our second language on the job, it's to speak to someone directly. But there are a few important differences between acting as a direct provider of service and an interpreter. We realize you may even be called to perform both of these roles in the course of one single day. So the important thing is knowing when and how to switch into the interpreter role when you need to, and to make others aware when you're changing hats and taking on the role of the interpreter. Here are some examples of how the two differ. You can see that when we're in direct care, we're using our own words. We can express ourselves in the way that we're used to. We have instant access to all of the nonverbal communication that's going on as we speak with someone. We can ask and answer questions to move the conversation along, and we can add, take away, rephrase, or rearrange things to make it easier to get our own point across. When we're interpreting, our behavior is a bit more structured, and in fact, much more structured. So let's take a look at what that entails. Interpreting is largely about remembering and repeating words instead of making them up as you go. When you're interpreting, there's a delay in nonverbal communication. So you might be more aware of the nonverbal communication than the people speaking to each other are. You can ask questions when interpreting, but only to clarify your own understanding. You can't just ask anything you want. And when you're interpreting, you need to say things just as they have been said without adding or subtracting anything. Cecily, Sasha, and I are going to lead you through the four main interpreter roles. And when we do so, you're going to see some dialogues. During our dialogues, Sasha will be playing the role of the doctor or provider in each of the dialogues. Cecily will be playing the role of the interpreter in each one of our dialogues, and I will always be speaking as the patient in these dialogues. And that will be pretty apparent as we move through. But let's have Cecily talk to us a bit about the conduit role.
Okay. So there are four main roles that come into play when interpreting. I like this pyramid because the size of each section generally correlates to how frequently you use that role. So with the conduit, the primary function of an interpreter is to convert messages from one language to another. Normally, these messages are conversations between two people speaking different languages. Do not insert your own opinions or questions unless you inform the provider and patient that you're speaking as the interpreter. Then return to your role as the interpreter. Do not initiate or take part in any side conversations. Keep good boundaries so that the conversation stays centered on the people you are helping. Let's take a look at this role in action.
Here comes the injection. Are you ready?
Here comes the injection. Are you ready?
Will it hurt?
No, I've had the same thing. It's a tiny pinch, don't worry.
Oh, okay, great. Then I'm ready. Yes.
Yes.
All right, let's do it.
Oops. The interpreter wants to make the patient feel more comfortable, but what they effectively have done is excluded the doctor from the interaction. This doctor is less likely to trust this interpreter now. You can avoid this type of confusion by sticking to your message converter role.
Here comes the injection. Are you ready?
Here comes the injection. Are you ready?
Will it hurt?
Will it hurt?
Not at all.
Not at all.
Okay, great. Then I'm ready. Yes.
Okay, great. Then I'm ready. Yes. Perfect. What a good interpreter, parroting other messages exactly as they're said. Now that we've mastered that, let's move on to other roles an interpreter plays.
Okay, we're going to move on to talk about the clarifier role of the interpreter. As an interpreter, you should never be faking it. If there's a word or a concept that you do not understand, ask for clarification so that you can communicate the idea as accurately as possible. Ask them, as the interpreter, what they mean, or ask them to repeat or rephrase it. Highlight misunderstandings you witness that the other two speakers might be unaware of. These interventions are appropriate when you're acting as a message clarifier, but keep them quick and return to the message converter role as promptly as possible. Here's an example from real life.
You live with your mother and your sister?
You live with your mother and your sister?
Yes, that's right.
Yes, that's right.
And how old is she?
How old is your mother?
She's 75.
She's 75.
Your sister is 75. Wow, that's a big age gap for a 29-year-old woman like you.
Here, the interpreter is confused because the doctor has asked something confusing, but instead of clarifying, the interpreter just decided what they thought the doctor meant. It wound up being a little funny in this example, but when you assume you know what someone means, you can actually put them at risk if you don't clarify what they actually mean. If there's ever any doubt, clarify. Let's try that again.
You live with your mother and your sister?
You live with your mother and your sister?
Yes, that's right.
Yes, that's right.
And how old is she?
The interpreter wants to clarify, you would like to know the age of her mother?
Oh, sorry, yes. How old is the mother?
How old is your mother?
75.
75.
There we go. The interpreter heard something confusing, called attention to it, and then continued converting the message. Let's move on to the role of the cultural broker.
Yes. So, cultural broker. All communication gets filtered through culture. This is particularly challenging when the two people communicating are from different cultural backgrounds. One role of interpreter is to help with this realm of communication. Many things operate here: tone of voice, appropriate greetings, body language cues, use of idioms, and etc. Often, bilingual people are bicultural as well. In the cultural broker role, you may leverage your cultural background to strengthen the communication between provider and client. This may be as simple as saying, the client has raised his middle finger, and that gesture has meaning here in the United States. Or, doctor, the word surveillance comes across as creepy and harsh in Russian. Again, if you're bridging a cultural gap, do it transparently, letting all parties know you are changing roles for a moment, then return to converting the message. Let's see a practical example. And has your chest pain resolved now?
And has your chest pain resolved now?
My chest didn't hurt. What I felt was just tiredness.
My chest didn't hurt. I was just tired.
The nurse said you had some shortness of breath and chest pain.
The nurse said you had some shortness of breath and chest pain.
Yes, that's right, but my chest had tiredness, not really pain.
Yes, that's right, but my chest had tiredness, not really pain.
Interpreter, am I missing something? So here it looks like the interpreter is doing an okay job, but the doctor winds up confused. Don't be afraid of confusion if a doctor says, I have no idea what she's talking about. You can interpret that and you usually get some good clarification out of it. But when you have special cultural knowledge about the population we work with, when they say things that are confusing to the provider but makes perfect sense to you, a good interpreter may leverage that contextual knowledge. Here's another example. And has your chest pain resolved now?
And has your chest pain resolved now?
My chest didn't hurt. What I felt was just tiredness.
My chest didn't hurt. What I felt was just tiredness. The interpreter wants to mention often when our Spanish speaking clients say tiredness, what they're describing is actually shortness of breath.
Ah, thanks. That's helpful, sir. Were you having shortness of breath or pain in your chest?
Thanks, that's helpful. Sir, were you having shortness of breath or pain in your chest?
Shortness of breath.
So notice how the interpreter is faithful to converting the message, but quickly interjects a little bit of cultural knowledge that redirects the doctor's line of questioning. Ideally, the interpreter would also let the patient in on what they have just said, but that was too much text for this slide.
The next role of the interpreter that we're going to talk about is the advocate role. In your role as an interpreter, you may need to act as an advocate for the client or patient. Notice this is the smallest area of the pyramid, meaning it's a small part of what the interpreter does. It's a little bigger on this slide because we're talking about it. And though it's a delicate role that should be handled carefully, advocating can be a powerful part of what interpreters do. Advocating for your client can be as simple as matching their tone, conveying if they're hurt, angry, or suspicious by being faithful to how they speak. Or it could be as simple as letting the client know interpreter services are free and they can request an interpreter at any time. Often the provider and patient speak in different registers. Don't be afraid to ask the patient if they're confused or if they don't understand what's being said. In that case, ask the provider to try and explain it another way. That's called lowering the register. This is another example of advocacy. Let's take a look at one appropriate example of how to act as an advocate.
You originally presented with emesis and 8 out of 10 lower abdomen pain, which seems to have resolved with the PPS we wrote for last week.
You originally presented with emesis and 8 out of 10 lower abdominal pain, which seems to have resolved with the PPS we wrote for last week.
Thank you, doctor. I trust in God first, and then I trust in you to know what's right.
Thank you, doctor. I trust in God first, and then I trust in you to know what's right.
This is a real example of something said to one of our clients. And on paper, it just looks like good interpreting. This marvelous interpreter knows all of the medical terms and says exactly what the physician's saying. Perfect, right? Well, unfortunately, in real life, the patient had a confused look on their face, and the interpreter could tell that their response was a polite indication that they didn't have a clue what the doctor was saying. Let's look at what the interpreter did.
You originally presented with emesis and 8 out of 10 lower abdominal pain, which seems to have resolved with the PPS I wrote for last week.
You originally presented with emesis and 8 out of 10 lower abdominal pain, which seems to have resolved with the PPS I wrote for you last week. Sir, I'm sorry, but did you understand what I just finished saying?
To be honest, no, not really.
Doctor, the interpreter repeated what you said and then asked if the patient understood. His response, to be honest, no, not really.
Ah, okay, let's go back.
Here, our interpreter picked up on nonverbal cues that the patient was lost and intervened in a quick and ethical way. They advocated for the patient by making this lack of understanding known. And then she handed the reins back to the physician to continue the interview. That's it for our discussion of interpreter roles. Now let's talk about some standards that we follow to help us adhere to all of these roles.
So the first one is accuracy. Do not add or admit anything in the communications. If you think you have, correct yourself. Strive to interpret accurate and complete messages back and forth.
Confidentiality. Let both parties know that whatever they share is safe with you and will not be shared with others.
Impartiality. In your role as interpreter, it doesn't matter how you feel about sex, drugs, or rock and roll. Repeat what the speaker says without bias and without giving advice. If you cannot remain impartial because of a strong religious stance or other personal conflict, excuse yourself politely from the encounter.
Transparency. This is a standard and central in everything you do as an interpreter. When you act as an interpreter, tell people who you are, what an interpreter does, how they do it. Tell them when you start doing it and when you stop to take on another role. No one should have to guess if you are speaking as yourself. When you don't understand something or when you are unable to interpret something, make it known. Being transparent as an interpreter is how you build and maintain trust.
And so let's look at some concrete things that you can do to support adhering to these standards.
These are just a few basic tips that support the direct connection between the people we are helping. The first one is using first person speech in order to tell people to address each other directly as they would if they shared a language. This reduces the length of messages, avoids confusion for all parties, and helps the provider and patient maintain eye contact. For example, you would say welcome instead of saying the doctor is saying that he wants to welcome you.
Avoid the triangle when you're interpreting. Instead of having the interpreter have to play ping pong by looking back and forth between the doctor and the patient, a good interpreter will stand right beside or slightly behind one of the two speakers so that they can address each other directly.
Allow time for introductions, pre-session. Most people have never received training on working with interpreters, so take a few moments to let them know how your new role works and how you facilitate the sessions.
And then we have managing the flow of the exchange. It's perfectly all right and often necessary to ask people to stop, pause, rephrase, or repeat their message so that you can do a good interpretation. You should make sure to announce when you are speaking for yourself as the interpreter.
Here are some things you might say as the interpreter.
Could you speak a little more slowly?
May I actually stand right next to her?
I need to excuse myself. This is a traumatic topic that I don't feel comfortable talking about.
I think that gesture he made has some meaning.
I don't think she understood that. Could you rephrase it?
I'm sorry, I don't know that term.
This is a little over my head. I'd really like to connect you to one of my colleagues. Is that okay?
Could you speak in shorter sentences? I want to make sure I get everything across.
Just speak directly to each other. It really does make a difference.
Honestly, I can't understand what they're saying.
Can you move closer to the phone? So, which of these things are you allowed to say as long as you identify yourself as the interpreter? The answer is all of them. Once you put on your interpreter hat, you're responsible for making sure that the conditions allow you to fulfill your promise, getting the message across.
And remember, you are part of a much larger team. And if you find yourself in a tricky interaction that is a bit beyond your interpreting skill or comfort level, there are qualified medical interpreters available to you at all times.
Hello, everyone. I hope you enjoyed this brief training. The purpose of this training is to provide you with some basic knowledge about interpreter role. Please do not hesitate to call us for help. Our interpreters are standing by. And you can find our phone number here, 24/7. We also have American Sign Language services through our agency interpreter, Bay Area Communication Access. And here's the phone number on the slide. In case you have any question, please feel free to contact us. And here's our email address. Again, I want to thank you for using your language skills in the battle against COVID-19. Hopefully, this short orientation will help you carry out interpretation services more effectively. Some of you may be inspired to become certified medical interpreters. Please contact us and we will assist you in any way we can. Thank you.